And there's a rule of thumb in terms of tissue. Nizawa Itomoto discovered back in the mid 2000s or late 2000, about 2007, 2008, that the volume of tissue has to be in a 1 to 1.5 ratio of vertical component to the horizontal component, meaning we need thicker tissue, 1.5 times greater than the vertical component. And we can think about this logically in our office. When we see long probing depths of 7 millimeters and the tissue is only 2 millimeters thick, we know that there is an issue going on around the tooth. It's the same thing with implants. The body will remodel until it gets to this point. So we know that there's a 2 millimeter rule that we need to have 2 millimeters of bone on the buccal. But the tissue rule is actually even more important. We need to have healthy, good keratinized tissue around our implants for long-term success. In fact, the zero bone loss concept, which is discussed by Thomas Linkovich from Lithuania, he did a study and he found that we need at least 2 millimeters of bone. But if you want zero bone loss, then you should have 3 millimeters of bone. And that's often very difficult. 3 millimeters of soft tissue. So having 3 millimeters of keratinized tissue horizontally doesn't always come by. Most of my patients that present to my office usually only have a millimeter or two. So often we need to augment the soft tissue, whether we're using cadaver materials, allogenic materials, or autogenous. Often we have to augment to be able to get to that 2 millimeter mark. And if we want to get to that 3 millimeter mark, you can be sure that we're going to need to augment. Oftentimes we'll have to do some various different techniques. But if we want to develop soft tissue like this, that's usually the only way, was to create enough thickness so that we can have this type of emergence profiling. Having a double offset on your implant, meaning a platform switch, is paramount to having this type of soft tissue. I wish I could say every one of my cases came out like this, and then we all know that that's not the case, and this is the cream of the crop that we usually show on the lectures, but this is what we should be striving for. If we can attain this type of soft tissue, we know the longevity of the implant, it's going to be around for many, many years, and patient's going to be able to enjoy lots of function and is not going to complain about catching food and having irritation every time they brush.